Hello, my name is Benjamin Illingworth, and I am a PhD student under Professor Murray and Dr. Langley at the University of Cambridge. By background, I'm a psychiatry trainee, and I completed my undergraduate medical studies at University College London before coming to the East of England to pursue my postgraduate studies. I'm very grateful for the funding that has been given to me by Mental Health Research UK, and today I hope to talk a little bit about my PhD project, which will be on the assessment of smartphone-based cognitive assessments in patients with first episode psychosis. I think it's important at this stage to give a bit of background as to why assessing cognition is important in patients with primary psychotic disorders. Patients who have a schizophrenia spectrum disorder I've found to have a very well characterised finding in that they have a cognitive deficit, which is generally 1 to 2 standard deviations below that of controls. The reason that this is an important finding is because it impacts on functional outcomes. It also impacts on the rates of hospital readmission. Patients who have cognitive dysfunction are generally less likely to adhere to their medication, which results in them relapsing more often. Despite the importance of this potential finding to clinical practice, this is often an area that is neglected. This is due to the high resource requirements that are required in order to implement these tests. It takes time and also expertise in order to interpret these tests and make them accessible for the wider multidisciplinary team. Studies have tried to overcome this, especially the time barrier, by ascertaining proxies for cognitive impairment in these subjects. However, there is another strategy potentially, and that involves outsourcing cognitive tests to the patients themselves for them to perform in their own time on mobile devices. There may, however, be barriers to this, including whether these tests are valid to be performed on mobile devices, and whether patients will find them acceptable and whether they'll engage with them. This is something that I look to inspect in my upcoming PhD project. Looking more closely at the PhD now. The overall aim of this PhD will be to ascertain whether cognitive tests can be used remotely in patients with psychosis. In order to answer this question, we'll be using data from a large cohort study, which is funded by NIHR, called the Mental Health Mission in Early Intervention Psychosis. We can answer various questions using this data, and also by interacting with the trial as it progresses. We will ask patients and staff who take part in this trial whether they think that these tests are both acceptable and feasible, and we'll look at how we can make these tests more engaging. Going forward, using the data, we want to answer questions about what contributes to cognitive impairment in these patients, and also whether we can use this data to predict further clinical outcomes such as risk of relapse. Looking at greater depth in the work passages that are associated with this PhD, I will start off by performing a systematic review of the current literature. This will focus on looking around the feasibility of using these cognitive tests in patients with psychosis, but particularly using them in a remote environment compared to using them in an in-person environment such as a hospital or a psychology laboratory. We will then conduct a study to validate and ensure that these tests are reliable and also valid in the population in which we intend to use them. We will ascertain a qualitative component as well to look at the acceptability and whether patients are engaged with these tests in the community. When we have data from the trial, we can look to characterise this patient cohort data using data science methods. And finally, potentially using machine learning methods, we can see whether the information for this trial can predict patient clinical outcomes by also looking at their healthcare record data. Thank you for taking the time to listen to this talk. I hope this has given you a bit more information about what I intend to do. And again, I'd like to thank Mental Health Research UK for the funding which they have given me. Thank you.